Hello, everyone, and welcome to Fearlessly Authentic. I'm your host, Jody Harrison Bauer, and I am so happy to have you join me for this episode today. This is the show that educates you, empowers you, maybe we entertain you a little bit, and inspires you to live your most fearlessly authentic life. Because in my humble opinion, if we're not trying to do that every single day, then what the heck are we doing here? We are a top 5% globally rated podcast, and it's all because of you. So please remember to rate, review, and subscribe, share with all of your friends, and we really appreciate you listening. Let's get on with the show. My guest today is Dr. Alexis Parcells. She is a board-certified plastic surgeon practicing in New York City and New Jersey. She has expertise in both surgical and non-surgical techniques, including in lasers, breast surgeries, and non-surgical injectables. Dr. Parcells is also the founder of Sunnie Skin, a medical-grade skincare and scar brand. She serves as a clinical instructor for medical students and residents and has presented her research on an international stage. Dr. Parcells is a mother, and she is on the ELLE Beauty Advisory Board. I am so excited for you to learn more about what Dr. Parcells does, and I am just really excited to get on with the show. So let's go. Welcome to the show, Dr. Parcells. It's so nice to have you here.
Thanks so much for having me. I'm really excited to be on your show.
Me too. I have so many questions for you. One of them is cellulite and scars.
Let's go. Let's talk about it.
Let's go. Okay. There's so much buzz around getting rid of cellulite, what actually works, and what's just marketing and hype.
Yeah, cellulite's a tough one. I mean, we now know that a lot of cellulite is genetic. And so there are just certain skin types and ethnicities that are prone to cellulite more so than others. When I first got into practice, there was a new medication on the market that was an injectable medication to help with cellulite. And I was an early adopter of that when I first started my practice because I had used that product actually for hand reconstruction for patients who had specific collagen bands in their hand. It was usually Army veterans. We used it a lot during my training, and it was an injectable that basically breaks down collagen. And so the whole idea was if we put it in and inject it into the bands that cause the dimpling and the cellulite, those collagen bands, it will dissolve and disperse, and it'll get rid of the cellulite. The problem with that particular injectable medication was that it required 3 sessions and it caused a tremendous amount of bruising and discomfort for patients. And so I initially trialed it on several members of my staff and family and friends, and it was just a no-go. Like nobody would sign up for the third treatment. And over the last year or two, they stopped promoting it and it actually went out of favor and they've recalled it and totally shut the program down. So that was thought to be the latest and greatest, I'd say, within the last 5 years. There's also a device called ELLE, which is a mechanical device that's placed underneath the skin to cut those bands. And again, I think that there's some promise with that. I know that I have colleagues that use it. There's discomfort with it. There's, some unpredictability in terms of what the final result will look like. But those are two procedures. One was an injectable and the other is a mechanical device that have been out in the last 5 years. I'm hopeful that there's more coming down the pipeline in terms of innovations for cellulite. But it's just one of those things where I see patients, I'm like, this is one part of your body you're just going to have to learn to love because there is nothing great. There's nothing great. Putting filler in there is not a great idea. Strategic liposuction is not a great idea because, again, that banding is happening on the skin surface. And it's really difficult to treat.
Can you explain exactly what cellulite is?
Yeah, it has to do with the orientation of the collagen and that. So our skin layer is our skin layer, and then we have our subcutaneous layer underneath. So we have the epidermis and the dermis is our skin layer, and then we have this fat layer, and there are some fascial attachments, and it's basically those bands that are in between that layer that create that dimpling appearance. And so you really want to get in and either mechanically break up the band or dissolve the band. But it hasn't, there's nothing that's been groundbreaking that's worth, in my mind, the time and money and energy investment to make a really profound difference. There's no cure for cellulite. So I really try to educate patients and set expectations on the forefront.
I've been in the fitness industry for 35 years. And, one of the biggest questions I get is like, so if I lose weight, will this get rid of my cellulite? And I always say, I don't know.
Yes.
I don't know. I'm not a doctor and I don't know, but you'll feel better about yourself once you feel healthier. And, that maybe it will go away, maybe it won't. I did always hear, and you said that it's genetic and it's more prominent for other people. So where is it most prominent?
I believe, and again, I would have to check the data on it, but I believe Caucasians it's more visible, it's more prominent. I believe that there's an island.
Lovely.
Yeah, right, us.
Lovely.
I always joke with my friends and patients who are Latino, are Asian, and African American. I'm like, you guys have the best skin. You're going to age so well.
I do. Well, my dermatologist, the last time I saw her, she said, yeah, it's just us white girls. We just got it bad. We do not age well.
No.
And we get all the things.
We do. But apparently there's an island in Southeast Asia where nobody has cellulite, which I think is fascinating because that, again, relates more to the genetic component. And I don't know if it's their lifestyle habits, their diet that also contribute. But I do remember reading that back in my training, that there are pockets of the world where women just don't develop cellulite. So, but then, those patients are also prone to keloiding and hypertrophic scarring. So they have this robust response with building elastin and collagen. And so it can go overboard during the scar process. So, there's good and bad to, grass is always greener, as I say,
Right. And just like, I have two daughters. They look different. They're built differently. And, I have friends and their children look differently. And one daughter has cellulite and another one doesn't. And why do men get cellulite?
They do. I just don't think they notice.
Oh, okay.
I mean, I think, they also, a lot of the areas where we see cellulite, they have hair. And so unless they're, keeping up their physique and, waxing or shaving, it may just not be as noticeable, right? You think about how a woman presents herself in a bikini on the beach and how a man is usually wearing trunks with hair. And so it's just not
It's true.
Conversation because it's
not fair.
It's not fair. Yeah.
Just not fair. So are there any suggestions as a surgeon that you can suggest to reduce the appearance of cellulite?
I think it's important how you select your wardrobe, right? So if you are self-conscious about a certain part of your body, you just have to dress for confidence. So something that may, look good on a friend or family member may look awful on you. And it's okay that not everything looks great on you. I mean, I don't have curves. And so I know I'm 40, so I know what fits me well. And I know that I can't wear a mermaid dress, look insane on me. And so it's good to lean into those timeless styles that suit your body. And if you're self-conscious about cellulite, maybe you're wearing the bikini, but you have like a really beautiful cover up that has, some peekaboo or some, lace. And so there is some skin being exposed. Or, if you're nervous about wearing a short dress, put a boy short underneath, just there are ways that you can dress up and still feel feminine and still feel sexy and you're also feeling confident, but you're not, feeling exposed and nervous about exposing.
Right. It's so frustrating just speaking about women having things that there's no cure for, right? So it's just, as a woman who I'm 64. And so when I was growing up.
Amazing. I was reading.
Oh, thank you.
We'll take care of it.
Thank you. But one of the things that I didn't grow up doing is we didn't put sunscreen on as little kids. So we had incredible sun exposure. So now as an aging woman, I see all of these white spots on my legs that were never there when I was 30, 35, 40. And I've been to so many doctors and everybody tells me there is no cure for that.
Yeah. You just have to get comfortable finding whether it's a tinted body moisturizer that has SPF in it. You have to get comfortable with what this stage of life brings. And, that's part of aging, and aging is a gift. I always remind people, you're lucky that you age and that you have your health and loved ones. And you just have to figure out, again, like whether it's going to be a certain type of makeup or a body lotion with SPF, how are you going to gracefully get into this, new, maybe it's initially be a challenge, but down the line, you're just accepting of it.
You do. You figure things out. I did find a very nice tanner type of makeup, leg makeup that I wear, like if I have a photo shoot or something like that. So, but sometimes I was just laying down in bed the other day and I look down and I go, wow, there are a lot of white spots. And you just have to, I accept it. Like that's part of aging and I'm lucky I'm healthy. So you talk a lot about scars. So what's the best scar creams or treatments you recommend for optimal healing, whether it's from surgery, stretch marks, or acne scars?
So when I started practice after my plastic surgery training, I started to do a lot of breast reconstruction and breast and body aesthetics. And patients would come to me after surgery and say, okay, what should I be doing for scar? When should I start? All of these questions. And that was something I really wasn't prepared for because my residency, my training was very much focused on reconstructive, other parts of the body where patients didn't necessarily care so much about their scars. And so then I said, okay, well, I have to do a deep dive into research and figure out what is clinically effective. And silicone really is the gold standard. So I created a scar kit as part of my skincare line about 4 years ago. And every one of my surgical patients gets this scar kit because I consider it to be part of the surgical package. It's the toolkit that I recommend them starting in around the 3 to 4 week mark. So after surgery, your incision, which will eventually become your scar, heals at a rate of 10% per week. So for the first, month or two, first month you're at around 30 to 40%. And then by the second month, 8 weeks, you're at 80%. A scar is never going to be 100%. It usually peaks at the strength of 80%. Once we get to around that 1 month mark, we're at about 30 to 40% of strength. And so at that point, the incision is no longer weeping any fluid. It's nice and closed off. The edges are healing nicely, and that's a great time to start scar care. So our system is a silicone gel, as well as a vibrating beauty bar, because the gel, we know, is 85% effective in softening and smoothing the appearance of scars. So we put the gel down, and then the beauty bar will break up those collagen and elastin fibers as they form. So initially collagen comes down, but it's really disorganized. And so the mechanical vibration, in addition to pushing it back and forth, will actually help the collagen fibers reorient. We know that mechanical vibration and massage are really helpful with scar therapy. And then the tape, I usually recommend patients just wear at night because they're getting 10 to 12 hours of therapy. Sometimes if you're working out during the day or you want to go in the pool, it can be annoying. So I usually give my patients the kit around the 3 to 4 week mark, and the scar can take up to 2 years to mature. So you can refill your kit as much as you want to or as little as you want. And I have some patients who say, I don't really care, and so they don't use the kit. And then I have patients who are really, they're just very compliant and they have, the best result that they can.
That would be me.
Okay. And it's interesting because it switches the dynamic from the surgeon. I'm like, here's your toolkit. And then if they come back and they're concerned, I'll usually start by saying, well, how is the kit going? And they'll say, oh, I need to refill, or, oh, I haven't been as compliant. And so I'm like, this is a great first step. Microneedling is really helpful with scarring. So once again, you're about 3 months out. Microneedling is great. Certain types of lasers are great. Ablative lasers, they'll help the cells turn over faster. So when I talk about microneedling and laser, it's not like you're going to wake up the next day and it's going to be mature. But what's going to happen is it'll help accelerate that maturation process and give some control over it. In terms of lasers, you can use an Iridium laser or a CO2 laser. If you have dark pigmentation, Latino, Asian, you want to stick with an erbium. CO2 is mostly reserved for Caucasian, lighter skinned, because it can cause pigmentation issues. I tend to stay away from steroids, and the reason I do is because it can flatten the scar and thin the scar. And you can actually sometimes even see the whiteness of the steroid, we use Kenalog, sort of within the scar, and it's a permanent pigmentation and patients can't stand it. So I really don't use that anymore. If we get to the 2-year mark and they're still concerned, I may strategically just remove a small piece of it, the scar, numb them in the office and do that. And then I'll usually put 1 layer of stitch, put some tapes down. And then at the 3-week mark, I actually pull the stitch because sometimes the stitches can cause some inflammation. And so by pulling that stitch, we're reducing inflammation and scar response.
I never realized how important the scarring process was. I know it's important if to turn over those cells into, you know, I know because I've had implants and I had a tummy tuck. So I know like how I scar. And by the way, everyone listening, tummy tuck is really, really hard recovery.
I had them too. I
Like
ouch.
it's horrible, isn't it? They don't even you surgeons don't even tell us how bad it's gonna be.
So it's interesting you say that because when I was in practice, I also have two daughters and they were 3 and 5 at the time. And I was doing a lot of tummy tucks and counseling patients. And I was like, I feel like a hypocrite because I really want to have this surgery done. My family's complete. I've gotten as close as I can to my pre-pregnancy weight, but I feel really self-conscious about this. And so I said, I'm going to do it. And I had one of my girlfriends who trained the year below me. She was out in private practice. I asked her, she said, it would be an honor. I'd love to do your tummy tuck. And yes, so having gone through that as a plastic surgeon has given me so much empathy for my patients who are going through it because I lived it. And so I felt like before I was a little more blasé, and now I'm like, girl, you need support. You need to take time. Do not, pack your schedule after surgery. Give yourself a few weeks because it's a muscle surgery. It's a real recovery.
It is. It's like you've done 1,000 crunches. Like the boob surgery, no problem. Yep, I'm driving my car a couple days later or whenever. I'm very compliant. But when I had the tummy tuck 3 years ago, the scarring, the thing that kept me from doing it, I didn't do it until I was 62 years old, is that because I was afraid of the scar. And I just did everything that the surgeon told me to do. And I learned so much more about how you just explained the whole scarring process, because underneath the breast, that's where my scars are from my implants. You don't see them. You don't pick up your boob to say, oh, let me see how I'm scarring. You just sort of notice it. But down here, now I don't even notice it. So anybody considering a tummy tuck, it's a really hard recovery, but it's worth it. It's worth it, right?
Oh, 1,000% would do it again in a heartbeat. There's no other feeling. It wasn't like I lost weight. It's just everything felt better. Everything fit me there. And then when I was going to the gym again, I could do my plank positions and all my core exercises. Right. And I just felt restored, just like myself again.
Right. And I really embraced this scar cream, and I wish I knew of yours, but I did the microneedling. I did all of everything they told me to do. And so I'm really happy with what it looks like. But it's so important if you're considering surgery and you want to scar well, I guess that's the way to say, is be compliant. Listen to your surgeon.
Absolutely. And I always say to patients, the shape wins over the scars. The scars will,
yes.
Your final result is what is going to make you feel your best. And if that requires scars, if you're accepting of them, it's going to be a complete game changer. And I've never had a patient say to me after surgery, I wish I didn't do this. I hate my scars so much. I've never had that.
Well, you must be an amazing surgeon. Also, I mean, you have to have the hand to do that, because you hear of terrible stories of surgeons leaving women terribly scarred.
Yes. Yeah. I mean, I think a lot of it boils down to patient selection. And as I get more mature in my practice, I think initially when I got out into practice, I was ambitious and wanted to please everyone and show that I'm capable. And now when I reflect on it, it absolutely, having that enthusiasm, that level of energy helped me build my practice really quickly. But, when you start doing more and more surgeries, inevitably you will have complications. And I always reflect on my complications. When we're in training, there's something called M&M in our residency, which is morbidity and mortality, where regardless of your specialty, we all come together and you discuss difficult cases and complications you've had. And so I mentally continue to do that exercise. And a lot of it that I have found is patient selection and partnership. And to your point, compliance, whether it's the scarring or not listening to instructions. In fact, patients call us telling us they're removing their drains, or their veterinarian husband's removing their drains. I mean, you can't make the stories up.
It blows my mind. They're spending all of this money, all of this time, the recovery, and they're not listening to the surgeon afterwards. It's like when a client comes to me and they want to they want to lose weight, and I tell them exactly what to do, and then they don't do it, and they don't understand why they're not losing weight, you know? It's just like, yeah, I love the word compliant. That's going to be my new buzzword because that's really what it comes down to. Why did you choose plastic surgery?
So I chose plastic surgery when I was growing up. I'm one of three girls, and my father is a urologist. Is that so funny? What are you? Are you the middle?
I'm the oldest of three.
And so my father's practice was in our house. The office was attached. And so from a very young age, I was just exposed to medicine and surgery. And I remember he would take us rounding in the hospitals, and we would get to scrub and, or observe operating room cases. And I just felt very connected to medicine. And then when I was in high school, I was at a symposium, conference in high school in the main auditorium. And the speaker was receiving an award, and it was Kathy McGee, who is the co-founder of Operation Smile. She and her husband, Bill McGee, Bill's a plastic surgeon, Kathy's a nurse. They started Operation Smile, oh my gosh, probably 4 years ago at this point. And so she was just talking about her experience and service. And there was an Operation Smile club, and I said, I've got to get involved. So I became the president of my high school club, and I started going on Operation Smile medical missions where they do cleft lip and palate surgery.
Really?
And I said, this is what I'm going to do. I mean, I was 15 years old and said, I'm set. And then went through medical school and residency. And then when I was in residency, as I was looking into additional training for cleft surgery, I began to realize that I would have to work for a big hospital system. And I was really enjoying community medicine. And at the same time, I was being exposed to breast reconstruction. And so just taking care of members of the community, waitresses, teachers, police officers who get this diagnosis, and you get to restore them back. I always say we're making lemonade. I love to ask my reconstruction patients, I'm like, okay, well, you have this terrible diagnosis, but if you could snap your fingers, what would you like your breast to look like? And so that's a really fun puzzle for me to solve. And so I pivoted towards reconstruction, and then just naturally reconstruction led to cosmetics, because as plastic surgeons, so my husband's an orthopedic surgeon. And so when he learned surgery, he sort of learns it from a textbook, and it's like 1 through 10 steps. But with plastic surgeons, we learn it's like a toolkit. So we learn these sets of principles. And I was able to just sort of, as I was doing reconstruction, I said, well, I want them to look like cosmetic results. So then I started studying and doing more cosmetic surgery. And so now I do a mix of breast cosmetics and reconstruction. And then that led into abdominal, labiaplasty, liposuction, all the fun stuff.
Are you busier than ever? I've read that plastic surgeons, especially for the facelifts and body, because everybody's lost so much weight because of the whole Ozempic craze.
Yes. Yeah. So a lot of women are now coming in wanting, oh, I want a tummy tuck, or, oh, I want a breast lift. And I'm like, what you need is a total body lift, right? Because you are a size 6, but you're wearing like baggy clothes. Right. And so it's not just the front with the tummy tuck that's going to solve this. You need a circumferential body lift all the way around. You need your thighs done and your arms. And so, but again, it depends on where that person is in their life and what bothers them. So I love to tell people that 95% of patients in plastic surgery are women, but only 15% of plastic surgeons are women. And so it's really exciting being a woman plastic surgeon, because I feel like I know what it's like after you're done breastfeeding, or I know, I myself lost 20 pounds this year. And so I know that battle to lose that weight and try to keep that weight off, and areas that you weren't necessarily insecure about, now you're insecure about, and, you may want to have addressed. So I always turn the mirror back to them and I say, okay, well, what's your priority? What is it that bothers you? And if their arms or their thighs don't bother them, I don't bring it up.
Right.
Because I don't want to create, any sort of mental, complex.
Right. I have been to surgeons where they've said, well, what about this? I'm like, I didn't know that was an issue. I never looked at that before. What do you mean?
I understand that. No. So we're very turn the mirror on the patient. What is the issue? And if I feel like, gosh, there's so much skin here, you may benefit from the body lift, I'll do that from an educational perspective, just to set expectations of what we can accomplish with just the tummy tuck, or if they need to go around to the back for the total body lift. But for the most part, I just keep it very centralized on what their goals and their concerns are, because the last thing you want to do is create a complex. It's the same thing when someone comes in for Botox or some strategic filler. I hand them the mirror and I say, what is it when you wake up that you're thinking about a couple times a day or a week? What is it? Because I see things that I think are beautiful features that define them. And I'm not looking to, say, well, you got a big hump on your nose, or, your eyes could really use a lift. They don't see those things. So who am I to bring them to their attention and create a complex? That's not helpful,
No, you sound incredibly empathetic. And I think that's what we need in plastic surgeons and really any kind of surgery. There needs to be a lot of empathy from the physician.
Just very much an attitude of you do you. Like, you're here to get good information. I'm not convincing you of anything. You need to decide what's best for your body. And I also say to patients all the time, go and get 2 and 3 opinions. You've got to vibe with the team dynamic, because I will be the one that does your surgery, but you're going to be seeing my nurse practitioners and the women in the front office and talking to the coordinators and the manager. And so if you don't vibe with the team, then you don't want to go on a journey with them.
Yeah, you're so right. Can you, since we were talking about body lift, I'm not sure exactly what that involves. Like, I had the tummy tuck, but like, what is, because I'm hearing a lot about the body lifts, but what does that mean? Like, is it lifting everything from, like, yeah, explain it.
Yeah, so there's upper body lift and then there's lower body lift is how it's traditionally characterized. So when we talk about upper body lift, we're talking about a breast lift, an arm lift, and a back lift. So it's basically everything above the belly button. So the breast lift is the scars are going to start sort of at the midline of the chest. And the breast scars usually end if you're wearing a shirt, you can see where that seam is that goes up into your armpit. That's sort of where the breast ends. And then the back lift will start there and go and meet in the back. So breast lift to back lift. And then oftentimes the scar will come up from the breast into the armpit and down along the inseam of an arm for the arm lift. So that's an upper body lift.
So the scar is under the breast, on the arm, like where the seam of my shirt is, like,
and then into the,
and then where the bra, and then in the back, it's where the bra line would be.
It's the back lift. Yep.
Okay.
So upper body is going to be breast and back, kind of like all the way around in a band. If you're wearing like bandeau, that sort of thing. And then the arm lift is coming sort of from that mid-axillary line up and over it this way. And so then when we talk about lower body lift, we're usually talking about circumferentially, so the tummy tuck. And then from the back, it's not like we're lifting the back skin all the way up. What we're doing is we're actually lifting the butt. So it's a butt lift, which has some lateral thigh, outer thigh component, and then a medial thigh lift. So again, if you're wearing a pair of jeans or a pair of pants, it's from the inseam of the knee all the way up, if that makes sense. So again, circumferentially around the abdomen and the buttock area, sort of pulling up this way.
And the top of your underwear, what the top of your underwear would be. So if you're wearing a bikini, you couldn't see the line.
Exactly. And then the thigh component.
Wow.
On the inside of the thigh.
So you're doing a lot of those right now.
So I will do certain parts of it. I am not a body contouring plastic surgeon, and there are a few colleagues of mine that I'll refer patients out to for that. But you can't get you should not have an upper body and a lower body lift all done in one procedure.
I can't imagine anybody doing that.
Right? You should not have more than 5 to 6 hours of surgery ever. Like, unless it's a reconstruction, but for a cosmetic, I mean, that's the rule of thumb. Anything over 5 hours increases your risk of anesthesia and surgical complications. So you should always ask your surgeon, how long is this going to take you? And if they tell you 8 to 10 hours, that's not, you just
no, yeah.
Too much on your body.
All right, let's go to the face.
Okay.
There are a lot of people out there talking about you could do face exercises. Do you think they really work? I mean, I personally do not, but because I'm 64 and I know how the skin is moving.
No, they don't work. They don't work. I always say to patients, what you do does not need to be expensive. If you have the mindset of I'm going to take care of myself, you will age gracefully. And what I mean by that is it's not just putting on SPF every day. It's I am going to, go for a walk every day. I am going to choose to eat. I'm going to choose to eat foods that, I can pick, like a carrot or a cucumber, a piece of celery, a salad. I think there's a big misunderstanding with a lot of friends and family and patients that that doesn't make a difference, but it does, because the skin is the largest organ of your body. And so if you're putting in soda and processed food, your body is taking that, whatever nutrients could possibly be in there, and sparsing it out, right? Like throwing rice.
Yeah.
If you're eating really nutrient dense foods, the cells in your body are circulating and saying there's plenty to go around. And so it absolutely affects your skin. Some people have dairy sensitivities, and they have breakouts, and they know it when they have dairy that they're going to have a breakout. And so I think just, between the sun exposure with the SPF and healthy diet, exercise, and then the mindset is also really important. So, I'm someone that I plan to continue to age gracefully. Just because I have access to unlimited Botox and filler and surgery doesn't mean I have any plans like that, right? Like I want my kids to recognize me.
Right. That's the thing. And, just like, let's throw in smoking and drinking. If you see somebody who's been smoking and drinking their whole life, I know I can spot a smoker or drinker or both across the room.
Yep.
It's what you put in your body is going to be reflected on the outside. Yes, you are going to age. We are going to see signs of aging. And it's just, I think my thought has always been, a little goes a long while. If you're taking good care of yourself, healthy diet, exercising, regularly sleeping, trying to reduce your stress, all those other things, they definitely do help, like you said. And I'm glad to hear you say that.
Yeah, it's really all about habits. So, I mean, for myself, like I meal prep because I know how busy I am, and I know that I am going to savage at 2:00 in the afternoon. That is like my trigger time. And so I have those, fruits and vegetables on hand because I don't carry anything else in my car. I'm usually driving around that time. And I go for a walk with my dogs every morning, and I try to, prepare. My husband and I go on and off on who's cooking dinner, make sure it's semi-healthy. But then, on the weekends, I allow myself to indulge and not be
80/20 rule, right? You got to have some balance.
absolutely.
Otherwise, you're going to feel restricted. Going back to the face, how does a woman know that she's ready for a facelift? And what is the best age to get one, if there's an age?
Right. And so Sarah Jessica Parker came out, I think like a year or two ago, and was like, I was supposed to have that done in my 40s. And we were all like, no, girl. Like you were like, I usually say 50s, 60s. Usually what we're seeing now is women are starting to meet injectors in their 30s and 40s. And they're doing a little bit of Botox, maybe a little bit of filler. I always say when you are deciding that you're going to start with injectables, because usually what happens is you'll start with injectables and do some skincare, maybe some microneedling, and then you'll jump over surgically because filler can't solve the problem. But it's important when you're picking your injector, remember you're picking your team. And so when you're picking your injector in your 30s and 40s, make sure that you like the way that they look and that you've seen their befores and afters. And make sure you say to them, when it's time, I need you to tell me it's time, right? So give me that honest feedback that I've got a turkey neck or I've got some lower joweling and I need to get an opinion, right? And it's the same thing if you see a derm or a plastic surgeon, like just be honest with me when you feel like it's time. I partner with this dermatologist in Manhattan, and she'll always be sending me patients for upper eyelid lifts because she's like, Botox isn't going to do it. You need to go and get your upper eyelid lift. And then they go right back to her for all their treatments. So I have a really nice relationship with dermatologists and injectors where, they come to me for the surgery and then right back out to them. I'm not looking to poach patients. And so I think that symbiotic relationship is really helpful because the injector can continue to do the Botox and filler after you've had your facelift, strategic, and all of those things. But usually what we'll see is, you're getting skin laxity, and putting in filler or Botox is just going to make you look puffy or make your laxity worse. And so for some people, that's like late 40s. And for some people, that's early to mid 60s. It really just depends. And
Right.
you're saying earlier, like our Latino and African-American, sisters, they are lucky,
They are. They're really, really lucky. I'm very jealous.
Same.
Yeah.
Same.
I've read that a lot of, and this just could be to get patients in early. A lot of doctors say it's preventative to do all of these things earlier or to get a facelift earlier. And I always thought that it was around just like as you're getting to be postmenopausal because you're losing all of your hormones. You lost your estrogen, your testosterone, your progesterone. And those are the things that help give our skin elasticity. And that makes sense. And if I could go back and say, oh, I wish that I had done something, I'm looking around for a facelift now. And I see so many women also continuing when they are postmenopausal, not getting a facelift when they need one and still getting injections. And you just want to say to them, stop. You need a facelift. Like none of this stuff. You're spending all of this money on injections and fillers and all of this other stuff that your dermatologist has in their office. But what you really need is for the skin to be cut and to be, to do a facelift.
That's right. So I don't recommend the preventative, like, let's do this in your 40s, because every time a surgeon goes in and cuts, they create scar tissue. And this is also the reason I'm not a big fan of fillers that are semi-permanent, because they're hanging around long enough for scar tissue to potentially develop. And so,
like which ones stick around?
Drugs, those types of, I think Radius is the other one. So I use hyaluronic acid-based fillers, first because you can dissolve them. God forbid there's an occlusal injury, like they get into a blood vessel. But second, because they don't, we're seeing now on MRI studies that they're lasting way longer than what we were told. We were initially told, oh, filler gets dissolved over 6 to 12 months. No, we're seeing that filler is actually lasting and it's migrating. So you have to be very careful about who's placing your filler, how much filler they're putting in, which is why the younger generation, it scares me to see these 25-year-old girls with massive lips and filler everywhere, because they're going to be a disaster in 20 years if it's not done correctly. But when the plastic surgeon goes in and does the facelift, they're creating scar. And so now if you're 65 and you had your first facelift when you were 45, they're going into a plane that's full of scar. And what's buried under the scar? Your nerves, blood vessels. It's very hard to see the anatomy. And so you're at a significantly higher risk of an asymmetry or a complication, because there's either so much product in your face or someone's already been there. So, it's the same reason we don't like to do tummy tucks if you think you're going to have another child, because we're going to go through a whole plane of scar to try and retighten everything, and how much skin can we take out, and your belly button, there's variability in how that's going to settle. So it's usually, I say, for the facelift and the tummy tuck, you want to be a sort of one and done. So you get to where you're like, okay, I'm going to get sort of the best bang for my buck. We say on average, face and neck lifts last about 10 to 15 years. Okay, so now I'm 75 or 80. And then...
Right, that's what I'm thinking for myself. Like, I need a facelift. I'm 64. Let's do it. I'll be like 80 when I need my next one, or maybe 75. I don't know. No, 75, 80. And like, that's probably the face I'm going to die with, I'm thinking. But I don't know. Well, we'll see what I look like when I'm 80. But yeah, that makes so much sense when you explain the scar tissue. And I don't think a lot of the younger girls who are saying, oh yeah, I need to do this because it's preventative, and get some facelift at 42 when they don't need one. The 42, they don't need one.
Well, it's the same thing with the baby Botox and the neuromodulators, where they have the young women starting in their like early 20s and saying, okay, a little bit of this, a little bit of that. But what happens is every time you inject Botox, Dysport, Jeuveau, Daxi, any of these neuromodulators, part of the component that goes in triggers a small immune response. And so it is possible over time that you develop immunity to the Botox, right? So you start when you're 20, by the time you're 60, it's not working. Well, now you're having incontinence in your 60s, right? And you want a little bit of Botox to go into your bladder to work, the urologist to inject it so that, it helps with your incontinence. It's not going to work because you've been putting in your face for 4 years. So I'm very slow and steady on all of these things. I say good SPF, sun protection, whether you're tinting your mirror or you're wearing a hat. And then these little handheld microneedling devices that you can get online just to stimulate a little bit. I mean, that's really all you need in your 20s. It doesn't need to be, as crazy as it.
I know. I know. My girls are 36 and 32, and They just wanted, the oldest one just had Botox. I'm like, okay, you could, here I am telling her, yeah, it's okay if you have Botox, but I didn't want them to start too early. And I didn't know why, but it was probably, I just, there was no reason for them to start early just because everybody else is doing it.
Exactly. And I've even cut back. So when I was first started doing it, because I had, again, access as a resident and was training on it, I would do it 3-4 times a year, like clockwork. And now I do it twice a year. I wait for it. You can even see now, like I have all my lines coming back. I wait for it to fully wear off. And then I'll go and do a treatment. And unless I have like a life event, like my sister recently got married, so I wanted to have it for the photos.
Sure.
I'm okay like looking like this. And I think it's good to be able to see a plastic surgeon who doesn't, who's embracing the natural aging process. Yeah, I do a little bit of filler, very open about what I do. I do a little bit of Botox. I've had a tummy tuck. I've had liposuction, but I think it's really important to be on board with aging gracefully and then just saying, I'm going to do a little bit of this and a little bit of that. And I'm not going to feel bad about it. And I don't care if you talk about me. Like this is.
Yes, yes, I love your attitude. Yes, and by the way, my other daughter, one of my daughter's names is Alexis. Um, so it's such a pretty name. Is there such a thing as a mini facelift, or is that just something somebody made up?
There is. I put it in tune with like a mini tummy tuck. Like we're doing a little bit. It definitely less downtime. Are the results as dynamic? No, they're just not. When we're talking mini, we're talking a little bit of this and a little bit of that, and so. I always say to patients, if you're going to spend the time, money, and energy, and you are a candidate for the real deal, you should go for the real deal. Because in my experience, you're not going to be thrilled with a mini.
And you've just wasted all that time and money.
Yeah.
Right. I agree. Go for it when the time is right. All right. So let's talk about labiaplasty, something that is like a taboo topic. Nobody likes to talk about it.
I love to talk.
So can you... Yeah, I know you do. So let's talk about it. Explain what it is, what the procedure is, and so on.
So it is it's a procedure I do. I've done so many now that I do it in my office, and it's a half hour. So a lot of women, yeah. So a lot of women, they develop extra labial tissue, and I see it at all ages. And when I first got out into practice, again, this was not something I commonly saw in residency. When I got out into practice, women started finding me and asking me, will you do this? And I said, yeah, I mean, I've done a handful. I will get myself up to date on the latest techniques. I talked to colleagues around the country, and I put together my own protocol. So we see it. I believe it happens when there are fluctuations in hormones. So I see it in women, young girls, 19, 20 years old, after they go on birth control, some form of birth control. I'll see it after multiple pregnancies. I will see it perimenopausal. And it's just extra tissue. It's mucosal tissue, and it drives women crazy. They complain of chafing, discomfort. Clothes don't look great if you're wearing like a tight bathing suit. Issues wanting to be intimate with your partner, discomfort. During sex, and especially during COVID with all of the spinning that was going on with Soul Cycle, and what's that other company?
Yes.
Peloton. So come in and we apply a thick numbing cream for about 20 minutes, half hour, and then I inject some numbing medication, and I just take the extra skin out. I'll tuck the mucosal tissue back, and I put in 2 layers of dissolvable stitches. And then I inject long-acting numbing medicine, and patients are icing. They can shower the next day. If you've had a vaginal delivery, it's similar to that. You're going to be sore. You're going to feel sore for the first few days. But most patients are sort of, working from home or taking it easy for the first 3 to 4 days. And then no stitches need to be removed because everything's dissolvable. It heals beautifully because it's mucosal tissue. So it heals like the inside of the mouth. So you don't see visible scars. And then I usually say you can get back on a horse or a motorcycle or a bike around 4 to 6 weeks, sex 4 to 6 weeks. If you have your period, you just wear pads for the cycle. Super high satisfaction. Patients are like, why did I wait so long? Why was I so insecure about this? A lot of patients are super apprehensive about needing to go to a surgery center or hospital and people reading what they were having done and judging them. So we've looped it in office, and I have not had a patient say to me, I want this done. I need to be knocked out. Usually we just coach them through it. The only time I'll do it in a hospital is if I'm already doing a breast lift or an augmentation or a tummy tuck, and to like throw it on. At this point, it's part of the mommy makeover. Just take care of it. Yeah.
Oh, I can't even imagine. I have to like take a Valium or something for everything. Like if I'm, even when I get any injections, which I'm trying not to do as much anymore because as you mentioned, since I do want to get a facelift, I'm trying to just let whatever was in my face start dissolving.
To your point, oftentimes plastic surgeons will dissolve you because they want to see what things look like so they can properly do the facelift. And then sometimes they will add strategic fat. So where your filler is, they could do some liposuction and take some fat while you're asleep and inject the fat as opposed to filler. And then you're done because the fat doesn't dissolve. So my colleagues that do a lot of facelifts often inject fat strategically at that time.
I think I have a lot of sculpture of my face.
Yeah. I'm not
know.
not a fan.
I know. I'm just like, oh, okay.
You look great. You look beautiful. Honestly, I think you're gonna be fine if you decide.
It's these bands, but we'll talk about it later. Thank you for explaining that because I do want women to feel educated and empowered, which is the theme of this show, to be their most fearlessly authentic self. And if they don't feel like they can be fearless and authentic because they feel uncomfortable about their labia or their breasts or their body, you and I are not here to say, run to your surgeon. We're here to say, embrace where you are right now and start maybe looking at the things that are really bothering you, that are really causing you to be uncomfortable or self-conscious. And that's when I think that's when you go and you find a surgeon that, like you said, vibe with the whole crew. It's not just the surgeon, it's everybody else there that you can trust and has great bedside manner and you see their work.
No, absolutely. And I always say to patients, when you're thinking about something multiple times during the day or several times a week, it's worth getting an educated opinion. And you don't have to act on that opinion. Remember, it's your body. You just need to sit with that information. And oftentimes I'll have patients say to me, okay, I'm ready. I want to book. I'm like, no, we're not booking anything today. You're going to go home and you're going to sit with the information. You're going to sit with yourself.
Right.
And just give yourself some grace and some time. And, if you really feel like we're a good fit, then call us and we'll move forward. But I don't ever want someone to feel like, oh, there's a pressure tactic, there's a sale, there's a this. No, I mean, ultimately, this whole experience, it's difficult to go through a surgery. Like, it's not pain-free. You have to make sacrifices. Your family may have to help. I mean, it's a to-do, so it has to feel right. And sometimes I don't hear from people for like years. And then they're saying, I really appreciated when you gave me that honest opinion way back when. Now the time's right. I can, my kids are now in college, or, now I'm newly single and I want to get back out there. And I always wanted to do this, but my significant other, shamed me at that point. And so it's just worth getting the information, and you should never be pressured into a decision, but it may just provide some clarity for you to know what your options are.
Yeah. And if I may add, if you see a surgeon, because the way it usually goes, you sit down with the surgeon and then there's the money girl or the money guy who sits down and tells you how much the procedure will cost. And I know that I've been in situations where I have felt pressured by that money person in that office, the girl behind the desk. And like, well, you better get it now or the doctor's price is going to go up and things. And just walk out of that office.
Yes, absolutely. 100%. When we first started, I had a plastic surgery consultant because, again, I never learned any sort of business or accounting or marketing training. So when I started my practice, we had a consultant, and she said to us, after you're done meeting with a patient, have them get dressed and go into the office to meet with the patient coordinator to go through the finances. And we actually stopped doing that this year because we had a team meeting, and I said, you know what? I think it puts unnecessary pressure on the patient and the family. And it seems car salesman-y. So what we do now is we just say, get dressed in your exam room. And then I'll have one of my coordinators go in, and we have like a little rolling cart, and she'll sit there with the information and just present the information. There's no credit card processor there. There's no gimmicky sales tactics. It's what, and I also have a coordinator in on every consultation because there needs to be two sets of eyes and ears. Right. And then in the future, if that patient leaves and says, oh, Rachel, I had a question about this. What did she say here? Can you remind me? Because my coordinators will also make their own notes. Or, oh, I saw Bree, you were in there, and can you clarify this for me? Patients appreciate that you're here, you spent money on a consultation. We're giving you our best advice as an educated plastic surgeon and the team. Here's all the information. You decide what's going to be best for you. And if you don't get that vibe, you've got to find someone else because you should never feel pressured into plastics.
That's wonderful. I need to come see you. Let's talk about boob tape.
Okay.
I've read that it's a trending alternative to surgery. Can you explain that?
I mean, I've seen things come and go. I saw there were some plastic surgeons in Manhattan who were recommending a breast for a weekend where they were injecting saline, just straight up saline into women's breasts if they wanted like a weekend lift and charging thousands of dollars.
Why?
And my question about that, I thought that was horrendous. But my question about that, I was like, would they be leaking out the nipple like for an event? So that kind of came and went. Boob tape is another one. I think it's, you see the Kardashians and all their cutouts. And if they need to, meet a shape, that's where boob tape's going to be helpful. Would I wear boob tape for 24 hours? Absolutely not. I mean, you have to be careful about how long you're wearing these things because they can cause, rashes or blistering. But yeah, if you have an event and you need some boob tape to get into a dress, by all means. Are they going to help shape your breasts over time? Absolutely not. The lift or the reduction is what I'm going to need. Yeah, it's almost.
Thank you for clarifying that. Yeah. I have also seen a trend, and it seems like a lot of women in their 50s who are getting their implants taken out. I know for me, I have silicone. So my first ones in 2003 were saline, and then I went to silicone. And then these need to be taken out because they said they should be taken out every 10 years.
Yeah.
I think that's true.
Yeah. Jody,
I told you I'm very, very compliant. I'm very compliant. And I do get an ultrasound and a mammogram. But I have seen a trend on women taking their implants out. And what do you think that is all about? And do you see that trend also? And why do you think?
Absolutely. A lot of women identify as having breast implant illness. So there's been drama with implants since the 1960s when they first came on the market. And the reason is because when they first came on the market in the late 1960s, there was no FDA Medical Devices Act. So there was never any safety studies done on breast implants. And it's important to know the history because it leads to where we currently are in 2025. So back in the 60s, they were invented and they were very poorly made. So it was a very thin shell and a very gooey gel. And there were very high rates of ruptures throughout the entire 1970s and the 1980s. There were class action lawsuits against the implant manufacturers. Patients were concerned. They were causing, issues with their health and diseases. And then in the 1980s, the FDA Medical Devices Act came out and they said, okay, we actually need to retroactively study these devices. And so they pulled silicone off the market in the United States from 1992 to 2006, which is why you had a saline device in 2003. Because unless you're part of a clinical trial, you can only get saline. Now, saline is also made with a silicone shell. So there's nothing completely silicone-free on the market. In 2006, the FDA concluded their studies, and they said, we can't find any evidence that they're dangerous. Meanwhile, the technology advanced, so now we have a much thicker shell, a much more cohesive gel. So if you hear the term gummy bear implants or form-stable implants, we're talking about the 5th generation silicone gel implant. And that came on the market in 2006. And what else happened in 2006? We had the advent of Facebook. That's when Facebook really started getting up and coming.
Right.
Groups of women over the next few years started getting together and saying, I don't feel like my implants are safe. I feel like I'm sick. I'm not sure what's going on. These are all my symptoms. And that was the birth of breast implant illness because it was really a large community that could get together and talk about their experiences. And it's not considered an official medical diagnosis because I can't send someone for a gene test or a lab test. I can't draw blood and say, you've got breast implant illness. I can't send them for a mammogram or an ultrasound or an x-ray and say, yes, you've got BII. But that's not to say that what they're experiencing isn't real either. We just may not know in 2025 what's going on. And is it a certain type of patient that is predisposed? Maybe it is someone who, is more prone to inflammation or autoimmune diseases. I think we have a lot to learn. So our societies now, I'm a member of the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgeons, are spending time, money, and energy doing research to better understand what's going on. In our practice, I say to patients, you have the right to have them in and you have the right to have them out. It's your body, it's your choice. Right. In 2025, I can't guarantee your health is going to improve because we don't know what's going on a cellular level. But the data is showing that over 80 to 85% of patients who do decide to have their implants removed, they feel better. Now, is that psychologically because they just wanted them out? Is there something going on from a physiologic standpoint? Is it a combination of both? I'm not really sure. In our office, we have them do a survey when they come in, and then we usually survey them around the 1 year mark. And our data matches the national data, which is that the vast majority of patients feel better. And then in 2018, we had a recall of one of the major manufacturers' devices because of the 35 million women worldwide who have breast implants. There were 1,200 cases of an implant lymphoma related to textured implants.
I think that happened to my friend. She had, because I think she did them. I did mine. The set I have now is 2017.
Yes. And so if you had implants, if you had the textured implants from 2018, recall during that 2018 recall, there's a bunch of different profiles that have been recalled by this implant manufacturer that created so much anger and so much frustration and so much distrust when that recall came out. And so it really propagated, how unhappy patients can be with these devices. So I always say to patients when they want to have an augmentation, someone comes in and they say, I want to have an augmentation, or a reconstruction patient who decides that implants is going to be the choice for them. I always say to them, you were signing yourself up for a revision surgery or an exit surgery at some point. These are not going to be your forever repair. Way back when it used to be, let's get your devices replaced every 10 years. Now we're seeing more longevity around 15 years. But I say, when things start to feel off, if you feel hardening or tightness of that scar tissue, which is the normal physiologic response to the implant, your body forms scar tissue. We call that the capsule. If that feels tight, that could be a sign that the silicone implant is ruptured, then it may be worth having it revised. But if you're happy and life is good, I'll see patients who are like, should I or shouldn't I? And I was like, if you didn't have it in your mind that you needed to, and you like your size and shape, would you ever have them arise? And they're like, not yet. And I was like, okay, well, I'll see you when you're ready, So,
Right.
So those are loose guidelines. It's not like, on the 15th birthday of your implants, they have to be taken out.
Right, right. And I also think, our bodies change, our lifestyle changes. I competed for 10 years with these in the first ones. So, in fitness shows. And now as I'm getting older, I'm like, I don't know if I need them this size anymore. And I think women also have to understand that maybe that when they got them, that was a time and a place for them. And now that they're a little bit older, they don't want them anymore. And I think we have the freedom to choose. But again, to be educated and feel empowered to make those decisions for yourself is very, very important.
Absolutely. I always say to patients, at some point you wanted these so badly, you paid for them, right? My cosmetic patients. I have to remind them that at some point you wanted them so badly that you paid for them. And so you have to give grace to yourself that your life has changed, your body has changed, you're in a different place, and we are going to take them out. And if you need a lift, I'll recommend a lift. And then life goes on. And don't beat yourself up about this decision. It is what it is. And could we wake up tomorrow and there could be another recall? Yeah, it's like a car engine. It's not a natural device. It's a man-made device. So these things do happen, but your information's in a national registry. It's in our books. You have a copy of an implant card. So you should be, if you're, God forbid, your device was recalled, you should be notified every which way.
What would be the one thing that you want women to take from today or take from you as a plastic surgeon that you would want every woman to know about plastic surgery?
Don't judge yourself if you want to have something done. I always think about what is my mission? And it's that woman who, is on the couch, or, in the Midwest, doesn't know me, but she hears, a little bit of what we're talking about. And she's like, you know what? I wanted to have that breast reduction for 40 years. And today I'm going to call and make an appointment to do something nice for myself. And I'm not going to judge myself and I'm not going to feel bad about it. I am going to do something for myself so that I can be healthier, more active in my lifestyle, look the way I feel on the inside, enjoy my life. And if you feel like you want to share your story, you have every right to share your story. I always recommend to patients, if you talk about it, then it's your story and you own the conversation versus people talking behind your back. If you're honest about what you've had done, you own it. And so you get to share your perspective. And what I always find is when I talk about what I've had done, I get 50 women come around me and they all want to share their insecurities and what they want to have done. And so I think as women, it just makes us closer to just be honest and open and own it. And so that's sort of my mission is to cultivate that culture.
I love everything that you've been saying throughout this entire episode. I really wanted, I used to live in Connecticut. I really want to come back up there and meet you in person and have a consultation about a lot of things. After I had my tummy tuck, I felt some shame, and I felt being in the fitness industry, I never had a weight issue or anything like that. But because I had rectus diastasis, I had a slight hernia, and those were things. There was no fat they took out of there. But I had a bulge, and it made me very self-conscious. And I wasn't sure if I was going to share it, but I thought that would be selfish of me if I didn't share this. And I have so many women following me that I need to share this with them because I want them to feel empowered. And I got the same with that you were just describing. I had so many women reaching out to me and saying, I've been thinking about it, but I was scared. Tell me about your, everything that happened. And I was so happy to share my story. And, there were people that also did shame me, but I knew that was going to happen if I did share my story, and I was ready for it. So I agree with you. If you're listening and you're thinking about it, do not feel any shame and do it for yourself.
Absolutely. I mean, we only have one life to live. I mean, that we know of.
Yes, that we know of, right?
And so, yes, it's just being an authentic version of you. You should not feel, you should feel empowered to do things that, can improve the quality of your life. And
I agree.
You share. It just helps other women.
100%. So where can our listeners find you, Dr. Parcells?
I'm on social media at Alexis Parcells MD, both on Instagram, TikTok, Facebook, and YouTube. And our website is parcellsplasticsurgery.com. And we do see
wonderful.
Yeah, we do virtual consults. We see out-of-town patients looking for.
Oh, you do? Great.
Absolutely.
Yeah, I'm booking one as soon as we get off here. I really love your energy. I really do. I feel it through here, and I know the listeners feel it too. I really think there is something very unique about being a woman and going to a female surgeon. I really do. There should be more.
I agree. And thankfully, there are more. Thankfully that there are more women coming through training, and I love to mentor other women plastic surgeons. I have a partner, and our practice is growing. She's a woman. And it's just good vibes. So I appreciate it. And thanks for having me on. This was just such a wonderful conversation, and it's great to connect.
Yes. Thank you for your time. I'm sure you're very busy, but I'm thrilled that we had you. So thank you for joining me. And for everybody listening, we will see you next week. Bye-bye.